life in your years that count. This quote is actually very important with patients with incurable diseases because you never really know how long you're going to live. Like tomorrow you can go into kidney failure, and it's just like that. You can have function one day, the next day it's all gone. And so it's very important because having an incurable disease like FSGS, it really takes a big toll on not just your kidneys, but everything in your body. Because the filtering system in the kidneys, this glomeruli is actually being scarred. And once it's scarred, and you don't have that anymore. So there are many different aspects to this kidney disease, and that leads me into explaining. So there are two types of kidney disease, primary and secondary. Primary is pretty much it's in your blood, and there's no known cure or cause. Secondary can be caused by diabetes or lupus. Then there's 4 types of scarring: periolar, tip lesion, collapsing, and cellular. Periolar, this one is the scarring that I have. And it's caused, FSGS is actually caused by nephrotic syndrome. And nephrotic syndrome is where it causes swelling and protein leakage. Because the filtering system in the kidney is being scarred, so it's not processing protein. And your filtering system is actually being scarred. And the best way to explain it is by using a coffee filter. So when you have your coffee in the coffee filter, and then you pour water, the water goes through the coffee filter, it keeps the coffee grinds in, and then it makes your coffee. Well, when the coffee filter actually gets a hole in it, the grinds go into the coffee. It's just like FSGS. The protein leaks out into your urine, and it doesn't stay in your blood, which causes low energy, low protein in your blood. And it actually causes a lot of issues with like mental and psychological, because without getting that energy and that protein, you can't think properly. Then, which leads me to some symptoms. Proteinuria, protein in your urine, edema, swelling, hypertension, high blood pressure, hyperproteinemia, low blood protein, and then hypocholesterolemia, high cholesterol. And there are treatments, but not everybody, because this kidney disease is actually different in everybody. There's different types of scarring and 2 different types of FSGS. And some FSGS patients are actually steroid resistant. Because steroids are actually the first treatment you get, typically prednisone, but there are different types of steroids that they typically use. But a lot of FSGS patients are steroid resistant, which means steroids don't get you into remission, and so there's no point in being on them. So then they try immunosuppressants, because your immune system is actually attacking your kidneys. Then there's diuretics for water pills to help with anemia. ACE inhibitors, anticoagulants, because you are actually, with high blood pressure, you are actually at risk for strokes and heart attacks. Statins are for high blood pressure. A healthy diet is actually a big one. Exercising, not smoking, and vitamins. FSGS is actually the most common primary nephrotic syndrome in African American patients. And FSGS can actually recur in 30 to 40% of those who actually get a kidney transplant, which it's very hard to get a kidney transplant, but even when you're FSGS patient, it's even harder because it's such a high percentage, they don't want to give you a kidney transplant. So it's a pretty hard thing to go through. Diet is actually very strict. When I first started the diet, it was pretty much what can I eat or what can I not eat was so long that it pretty much was, if it tastes good, it was bad for me, which left it very hard. It's low sodium, lots of fruits and vegetables, low fat dairy products, lean meats, less red meat, more chicken and fish. The problem with eating protein is the more protein I ate, the more protein I lost. So it's hard to have a high protein, but then you can't have a low protein, so it's kind of difficult. And with treatments, it's even more difficult because nephrologists, there's no known treatment by the FDA, so it's harder to have a set treatment, like this person gets this treatment and it works for everybody. This doesn't work. So you pretty much have to go to the chemist. You get 5 milligrams of this medicine and 2 milligrams of the same medicine, and you pretty much up the dose and then lower the dose. And it's hard, but you get through it.
You're doing great, Desiree. You're doing good.
Good job, Desiree.
You're doing good, Desiree.